to our latest interview here at Top Doctors. Today we are very happy to welcome Mr. Bob Chatterjee, who is one of the UK's leading consultant spinal surgeons. And we're going to talk about something that affects all of us from time to time, which is lower back pain. So, good afternoon, Mr. Chatterjee.
Hello.
Could I ask you to just introduce yourself briefly for us before we get started with the questions?
Yes, of course. So my name is Bob Chatterjee, as you say. I'm a consultant spinal surgeon. I'm based in London. I trained in London, Oxford and Cambridge, and I've trained in all aspects of spinal surgery, both not only from degenerative or wear and tear, as we call it, but also deformity surgery, which is usually scoliosis and curved spines. So I've trained both from a neurosurgical point of view as well as an orthopedic point of view, and that tends to give a very nice balance of skills in our job. And spines is all I do. So I spend all my hours day and night doing spinal surgery, and it's my passion as well as my job.
Fantastic, thank you so much. So the first question we would like to know is, when should people see a doctor about lower back pain?
So I think it's important to say that low back pain often will clear itself up. It's one of the commonest conditions we see here in the United Kingdom. And for the vast majority of occasions, the causes of low back pain are usually muscular. And often they're associated with how you sit and how you do things. Often a lot of it's to do with your workplace and their setup and so forth. But most cases of low back pain settle by themselves. So we don't really recommend necessarily having to see a doctor straight away. Often good sources of treatment you can get from a physiotherapist or an osteopath or a chiropractor, just to name a few. Most cases will settle down in a few weeks. What I do say, however, is that you ought to see some improvement as you're progressing through the weeks. And really, if you're not seeing any improvement, or you feel that you've somewhat plateaued in terms of your recovery, I think that's the time where you ought to pause for thought and see, well, why is this? Why aren't I getting better? Maybe there's something else going on that might need looking at or treatment. So I think failure to improve over a few months, I think usually would be the signal to suggest that you ought to see someone about low back pain. I think the other thing to say is that sometimes you have associated symptoms with low back pain. So you can get situations where you start to get some weakness or some numbness or tingling or burning pain coming through the legs. And that often suggests that it's a little bit more than just a muscular problem, because it suggests that the nerves may be involved. So I think if you get symptoms such as those, then that also might be worth trying to see a doctor about to try and diagnose exactly what might be wrong with you.
Okay, thank you very much. That clears that up. So if somebody does come in with lower back pain, what types of tests are you likely to do to diagnose the cause?
So I always say to my patients when they come in that really our role initially is to be a detective, because our job is to understand why you're in difficulty and why you're having the symptoms. And in all honesty, through all the years I've spent through spinal surgery, although I can wax lyrical about spinal techniques and surgeons and so forth, when you come down to it, the fundamentals are really is getting the diagnosis right. If you do not understand the cause of the problem, you frankly have little hope of putting it right. And when you're trying to understand the cause of the problem, there are a number of things you need to look at. So first of all, the history. So symptoms don't come randomly in the spine. There are patterns to it. And so we actually like to spend quite a lot of time talking to you. I often spend half an hour, 45 minutes when I first meet someone, just trying to understand what are the symptoms, what type of pain do they have, where do they get it, when do they get it, which positions and postures make it worse, what do they do to relieve it? And all these things actually give you a really good idea of the sorts of problems that might be there. The next stage is usually examination. Now, examination isn't the most sort of specific thing you'll ever do. It's a little crude in all honesty, but it tends to sort of further or lessen your suspicions about what you think might be the problem when you listen to the patient. So it is important, and what we look at is we look at your nerve function. We look at the function of your legs or your arms, depending whether it's neck or back pain. We want to see your feeling and your reflexes, and this will give us an idea of your neurological symptoms. We also want to get an idea of your movement, because the back is all about your posture and how you move and bend over and do things. So we want to see that. We want to see you walk. We want to see you do a squat. We want to see you twist. And again, sometimes you can pick up some limitations in the movement that might help us understand what the cause of the symptoms might be. But no doubt, particularly in the last 20, 30 years or so, imaging has become really the mainstay of investigations. And there are a number of different techniques around, from X-ray, CT scans, and MRI scans. But the idea of the imaging, whichever you choose to use, and which one you should use differs upon the situation. But the idea is that you want some really unparalleled information about what's going on the inside of the spine. It's all very well thinking from the outside it may be a problem with a disc or the nerve or so forth, but you need to see some objective evidence of that. Because you even though you can have an idea of what you might think is wrong from the outside, sometimes you'll be surprised when you get a scan and it's not quite what you think it is, and we do see that quite often. So it's really a multi-stage sort of process, really, in trying to understand the cause of the symptoms. But not all of it is about imaging. Talking to your patient and examining them is equally important.
Okay, thank you. So going a bit further into that idea about imaging, what exactly is the difference between, for example, an X-ray and an MRI scan, and what does it tell you as the doctor?
So we use them for different things. It all depends what you're looking for. So an X-ray is probably one of the most simpler investigations and widely available at that. And what the X-ray shows you is it shows you the bones. And certainly if you're looking for evidence of a fracture or, so say, for example, someone's had a fall, that an X-ray is extremely useful. It's also useful at giving you an idea of your alignment. So we want to look at your spine to see, you should be straight from the front, but, when you look from the side, we've all got curves, in our neck and our low back and so forth. And it gives us an idea of the postural alignment of your spine. Sometimes if your bones are a little bit out of position or malaligned with respect to each other, you can see that as well. But it doesn't tell you much information about the other structures. So the bones, yes, and the alignment, sure, but not so much about the disc, not so much about the nerves. It doesn't really show you the soft tissues and ligaments. And that's where an MRI comes in. An MRI is really wonderful at that. It shows you the discs, it shows you the nerves in great detail, and you can see it in three-dimensional detail, and you can see whether things are pressing on nerves or not. You can see whether the joints are inflamed or not. You can see inflammation on the scan that in a way you can't see on an X-ray. So the better quality information is certainly from an MRI scan rather than an X-ray. But there are dangers in MRI scans, and one of the dangers is over-reading them. And I'm very fond of saying to my students that just because you see something on an MRI scan means nothing. It's more a question really of the patient's symptoms and examination and story matching up with the MRI scan before you take notice of it. So although it's wonderful technology, you have to be aware that sometimes it will show things that may not be relevant to the patient's symptoms. I think one drawback of both X-rays and MRI scans to a degree is that you also have to remember that they're taken with you in one position on one day. I mean, sort of think of it like a snapshot of the camera. It shows you what you're like in that position. But when you talk to patients, often they'll say, well, actually, it's not when I'm lying down, doctor, that it hurts me. It hurts when I'm standing up or I'm trying to run. So they, again, don't necessarily show you the entire picture, but it's a good base from which to start. I think the other investigation I would mention, which is common, is a CT scan. And a CT scan really is excellent at looking at a bone, but we don't do it typically in everyone. And part of the reason for that is that there is a radiation dose for the CT scan. And whenever you order any investigation of imaging, you need to think carefully about the radiation dose that you are giving a patient and make sure that it's justified. So you can't just do it willy-nilly. You have to be answering a question. So the MRI is useful in the fact that there isn't any radiation. But the CT gives me tremendous three-dimensional anatomy about a bone. So for example, last week I saw someone who'd fallen over and broken their neck. And the reason I wanted a CT, I wanted to see exactly where the bone fragments were. I wanted to see if they were going to cause any problems or not. And in the few situations that I have to operate, it also helps me plan where and how I'm going to reconstruct the spine. So they all have their uses, and often we'll do more than one depending on the sort of information that we'd like. But I would say that the MRI scan probably is the most common method of investigation that you'll come across.
Okay, that's already interesting. Moving on now to talk about treatment. Can you explain the difference between therapy like physiotherapy, osteopathic therapy, chiropractic therapy? What's the difference between all of those?
So I've worked with osteopaths, chiropractors, and physios over the years, and they're really good at what they do. And frankly, without them, I think the whole system would rather collapse, because the number of people who have issues with their back and their neck are legion, and therefore you really need an army of practitioners and healthcare professionals to look after them. I suppose if you look at it traditionally, what you could say is that a physiotherapist really tends to be a muscular-based therapy, and the idea is that your muscles all act in concert with each other when you're looking about your posture and your movements, and it's about working on those things and trying to make them as good as you can. The chiropractor traditionally will work more on the joints, and they are treating what they call subluxations or minor malalignments in your joint, and they're really looking at your mechanics from a structural point of view, and trying to make sure that your bones are all in alignment with each other, and that sometimes when your pelvis can be twisted or malaligned, that they try to put the right treatments in there. That can be hands-on treatment with sort of soft tissue manipulations and bony manipulations, but equally it can also be postural exercises as well. I think osteopaths tend to look at you a bit more holistically, but there are divisions within osteopathy. I mean, you find that craniosacral osteopaths are quite a different bunch to structural osteopaths, but I'd say osteopaths tend to look at you a little bit more holistically and look at the musculoskeletal system in combination with everything else around it. So things like your nutrition will affect it, your mental well-being, your blood pressure, your circulation, all these things actually contribute to a well spine and a system that works well in movement and activity. So osteopaths tend to do a mixture of soft tissue manipulations as well as some bony manipulations, but probably not as quite intensively as a chiropractor might do. But they're very good at analysing issues within the spine. And we work closely with all three of them really in terms of the practice that we have. I do say, again, I always say to my patients that, when you meet doctors, you'll meet all sorts. You'll meet good ones and not so good ones. And the same goes for a chiropractor, the same goes for an osteopath. You just need to find someone who's good at what they're doing. I must admit, I have over the years become less and less fussed about the number of letters after your name and more fussed about whether they're any good at what they do. So in my practice, certainly, I think it's a good idea that I meet all the chiropractors, osteopaths and physios I work with. And I think that rapport actually makes a big difference, because when you work with patients, often you've got to appreciate that we're all looking at the spine just from different angles. So we've all got something to contribute and something to add. So if you've got a good communication circle between you, it's better for the patient. And that's really all we're after at the end of the day.
Absolutely, that makes total sense. So thinking about treatments for individual patients, how do you go about advising whether a patient should look for physiotherapy as opposed to osteopathic treatment, for example?
So it depends entirely, as you say, on the problem that they have. So one of the things I try to identify is that when you look at most people's back problems, I suppose there really are four classic culprits that might cause your symptoms. So the four elements that we tend to look at is we tend to look at the muscles, we look at the bones and joints, we look at the nerves, and we look at the discs. And what I'm trying to analyze is what's the combination of those particular culprits that's generating this particular patient's problems. And that really leads me on to sort of choose who I want. So it's partly about the system. So for example, if I find someone who I think's got an alignment problem, say for example in the neck, I might well send them to a chiropractor. If I look at someone and the analysis has suggested that they've got, say for example, some tendinitis and inflammation of the gluteal muscle, then I'll send them to a physio. I sent someone last week to an osteopath, for example, who had some issues with the middle part of their spine when they were sleeping and the postures and positions they were in. So it is very much the diagnosis that I feel determines whom you see, but there's nothing to be lost by trying any of them in any particular sequence. Sometimes patients will come to me and say, who should I see, or what would be the right way? And the trouble with spines is not that well defined a science. It's not that for every single particular issue there is a set pathway and this is always the right treatment and anything else is wrong. It doesn't quite work like that. The way I sort of see it is that it's all very individual. Everyone has different types of problems. You've got to find the right key to unlock their issues. And so I call it a journey. You've got to start somewhere. And so I tend to pick someone that I think, an uneducated guess is most likely to be the type of therapy that will help that patient. But at the end of the day, you have to see improvement. That's what it's all about. And so I always say that, you should give a physio, osteopath or chiropractor at least a couple of months to try and make some difference. I'm not expecting you to be necessarily fully better by then, but I would like to see some evidence that you're heading in the right direction. And provided that's okay, we'll stick with that. But if it isn't working and you're not seeing any progress, this isn't about who's right and who's wrong. None of that matters. The only thing that counts is what works for the patient. And so we'll just try something else. We'll all get it right one day. We'll all get it wrong on other days. It doesn't matter so much. It's just making sure that we don't leave any stone unturned in trying to find the right answer for the patient.
Absolutely. I want to thank you so much, Mr. Chatterjee, for your really informative answers. Is there anything else you'd like to add?
No, I just think spines are complicated, and I think that there are so many reasons and problems that people get trouble with their spine. I think it's very frustrating, and I would say that I meet a lot of people sometimes who've sort of soldiered on for years and years and years. I think don't would be my advice. I think you're not meant to be born and living with spinal problems for the whole of your life, and often prevention really is better than cure. If we know about things earlier, it's much easier to stop you getting into trouble in the future. So we're always here and happy to help you. And I would say one thing that I often have to explain to my patients. Although I'm a spinal surgeon, surgery is usually the last thing you do. I was saying to someone the other day, I think on average, I probably operate on one out of 20, 25 patients that I meet. And the reason for that is most people don't need an operation. Most people need an understanding of why they're in trouble and what they can do to help themselves. And that, to be honest, is much as my job as being a surgeon. So I think it's good to know that when you come to see one of us, that we're not sort of looking always to find surgery as the answer to your problems. In fact, that's usually the minority of cases.
Okay, thank you so much. Thank you again for your time and for all of this excellent information. And I would just like to say that if anybody out there is watching and is suffering with lower back pain or is struggling to find a good treatment option for any lower back pain, they can have a look at Mr. Chatterjee's profile on topdoctors.co.uk. Thank you again, Mr. Chatterjee.
Thank you so much for having me. Appreciate it.
It's been a pleasure. Thank you.
Okay, bye-bye.